Who would have thought that social care would be such a big issue in this election campaign? So what are the main parties saying about social care in their manifestos? Let's start with Labour and Liberal Democrats, who have both said that they will put more money into social care. Labour want to get that from increasing the tax on high earners and on companies. Liberal Democrats want to raise the basic rate of income tax and possibly move towards a dedicated tax just for health and social care later on. Both parties support the idea of a cap or a maximum limit on how much people pay from their own resources towards the costs of care over their lifetime. That used to be the policy of the outgoing Conservative government, but to the surprise of many, it didn't appear in their manifesto. Instead, the Conservatives said it would be fairer to have a higher amount of money that people were allowed to keep after they'd paid for their care. Currently that limit is £23,250. They plan to raise it to £100,000. Controversial aspect of the Conservatives' plans is that for the first time, when working out what people have to pay towards the cost of home care, the value of their home will be included. Currently that only applies to residential care. The problem with some of these proposals, so for example they want to restrict winter fuel allowances to the poorest pensioners, and the plan to include the home in the means test will raise more money, but there are no costings, so it's really hard to work out who will gain and who will lose and by how much from these proposals. If we look across all of the parties' manifestos, a couple of notes of caution really. The first is that what parties say they're going to do before an election often turns out to be very different from what they actually do when they've won the election. And how many of these proposals will work in practice is very unclear. A lot of the detail needs to be worked through, and we need to be much clearer about where the money will actually come from. In particular, the choices about the money and where the money comes from are really, really difficult. For example, the idea that people should have to use the value of their homes to pay for care has been very, very contentious indeed. And that's why that although every government in the last 20 years has taken office with bold promises to sort out social care, they've actually found it much harder to do in practice. And I suspect that the next government will be no exception.